Hello, my name is Julie Murray, lead trainer for Inquiring Minds LLC, and I'm working in partnership with the Howard County Health Department to talk about mental health. Together we are producing a series of videos on taking care of your mental health in these times. Today we're going to cover some of the basic information around what it means to have mental wellness. Just like physical health, there are signs and symptoms, ways to prevent and treat your mental health. Mental health is a wide spectrum that includes being mentally well, becoming unwell, and being mentally unwell. We all go through ups and downs and may even go through the spectrum throughout our daily functioning. This means that we may have good moments, good hours or days, neutral moments, neutral hours or neutral days, and even bad moments, bad hours, and bad days. This is completely normal and part of the human experience. Sometimes though, folks are more on the becoming unwell or unwell side of the spectrum for the majority of the time. This is an indicator that they should reach out for help, or other people should reach in to help and provide some extra care and support during this time. Let's talk about some of those indicators that you may be becoming mentally unwell. One of the first impacts people notice is on relationships or even just interactions with other people. They might be more short or snappier with people. Perhaps they're getting frustrated or upset with their loved ones. Another indicator is perhaps they're pulling away altogether and they're not talking to people at the same level that they used to. Another good indicator is sleep. Sleep is something that you can do too much or too little of. What we know is that this is a big departure from normal. So you're struggling to fall asleep, to stay asleep. Maybe you're waking up a lot throughout the night. Maybe you're having really vivid dreams or nightmares. These are all indicators that something may be impacting your mental wellness, and it's a good time to talk to somebody else about it. Finally, we can talk about the impact on our daily responsibilities. So maybe you go to school or work and it's just become really hard to convince yourself to work or to go to school. Maybe you're supposed to do the dishes, and while most of us maybe don't love doing the dishes, you can't convince yourself to do the dishes. So you notice some things are piling up, like your responsibilities or your interactions with other people or school or work. These are all really excellent indicators that maybe you need to talk to someone because your mental health is starting to suffer. Who should you talk to? That's a great question. So your primary care physician is an excellent gatekeeper for many resources in all aspects of health. They can maybe treat you themselves or refer you out to other specialists if needed, just like we would for allergies or diabetes or anything that impacts our physical health. Next, you can find your own therapist or psychiatrist. Many places are offering telehealth right now, and if not, and if you need help finding one because your current provider does not, you can always call 211 or go to your insurance website or call your insurance to ask what is covered and also providing telehealth. Next up, you may be worried that somebody is in crisis. So if somebody is at immediate risk of harm, please call 911. You can also call 1-800-273-8255, which is the National Suicide Prevention Lifeline. Now, I know the title says Suicide Prevention Lifeline, and this might be scary to call. So first, it is totally okay to call them even if the person is not thinking about suicide or you're not thinking about suicide. It is a mental health crisis line. Second, you can also call if you're worried about somebody else and you don't know how to have that conversation. They are an excellent resource for helpers as well. If you don't want to talk, or if you maybe are deaf or hard of hearing, you can also text 741-741, which is the crisis text line. Here in Howard County, we have Grassroots Crisis Intervention Center. You can call them at 410-531-6677. They offer a wealth of resources to support anybody in crisis throughout the county. Finally, Howard County Health Department is here for you. If you'd like further information on behavioral health resources available throughout the county, you can call 410-313-6202 or go to the website at howardcountymd.gov/gethelp. Thanks for tuning in. We are wishing you good mental health.